Hey, thanks so much for joining us. Today, we're talking about the importance of who is reading your mammogram, and we're joined by Dr. Brian Johnston. He's a breast radiologist at Banner MD Anderson Cancer Center. Doctor, thank you so much for being here with us.
It's my pleasure. Thank you.
So let's start with this. What exactly are you looking for when you're reading a mammogram?
So with each mammogram that we perform, we do two views of the breast. So we compress each breast from top to bottom, and then we compress each breast from side to side in a somewhat oblique view. So I'm looking for overall breast density. How dense is the tissue in the breast? I'm looking for abnormal masses in the breast. I'm looking for abnormal calcifications, deposits of calcium that can be associated with cancer. I'm looking for areas of the breast tissue where it might be distorted from the normal flow of the breast tissue. And very importantly, I'm comparing these images with any prior mammograms that our patients may have had. That's so important that when our patients come, when any woman goes and gets a mammogram, if she's had a prior mammogram, that she either brings that with her on a CD, or she lets the facility that she's knowing where she's getting her mammogram at, where those are at, so we can have those to compare. That's really where the mammogram becomes powerful, because when I can compare year to year the mammograms, I can look for subtle changes that can allow me to find cancers even earlier, and smaller cancers, where those cancers, when I find these cancers smaller, there's better outcomes overall for our patients.
Good to know. Now, why does it matter so much who is reading your mammogram?
So I think a couple of things. When somebody's interpreting your mammogram, I think it's very important that that person has the adequate training, has experience reading many mammograms a year, and has access to the best technology. So when it comes to training, our radiologists here at Banner MD Anderson have all gone through an additional subspecialty year of training called a fellowship. And that is dedicated to imaging and evaluating diseases of the breast. We're all very well versed in the most up-to-date and best evidence-based methods of evaluating the breast. And beyond training, experience is very important. I think studies have shown time and time again that those of us who are reading thousands upon thousands of mammograms a year, we are better able to detect cancers smaller. We have better sensitivity rates, so we can detect cancers earlier. And also we have better false positive rates, meaning that when the mammogram indicates an abnormality that it doesn't really exist, we're able to tease some of those out a little bit better. And finally, technology is really important when it comes to getting your screening mammogram. We have access here at Banner MD Anderson to the most advanced, the most up-to-date imaging modalities to evaluate the breast, to include the tomosynthesis, or the 3D mammogram, high-quality ultrasound, breast MRI, and even contrast-enhanced mammography. And all of our screening mammograms here at Banner MD Anderson are 3D, are with tomosynthesis.
So knowing all of that, we all want to make sure that we have someone like you reading our mammogram who has that level of experience and is using that kind of technology. So when we go to make an appointment, how can we know that we are getting the best care provider possible?
Well, I think there are many great places here in the area to get your mammogram that have a lot of those, the technology, the experience, the training. But I think when you come to Banner MD Anderson Cancer Center, you gain access not only to these specialist radiologists like my team, but you get access to a team of individuals that supports your care. We, as the radiologists, we find and we diagnose the cancers, but we also work very closely with a team of top-tier breast surgeons, breast oncologists, pathologists, geneticists, mental health care providers. So if I find anything abnormal in the breast, I have a team of specialists that I work closely with that will be able to take care of it. A team that I trust, a team that I interact with on a daily basis. And that integrated and team-based approach is very effective and really the best way to receive care. Not many places will offer you an entire team, but you can certainly find this team-based approach here at Banner MD Anderson Cancer Center.
Yeah, we would all absolutely want that. Now, we've covered so much already, but is there anything else you want to mention that really sets Banner MD Anderson Cancer Center apart from other places where you could go get a mammogram?
I think one of the most important things that my colleagues and I, we feel it's very important that when we see our patients that we take the time to listen to them. We offer our time. We give our time. We listen to their stories. We listen to their concerns. And I think when you listen to a patient, you're better able to understand where they're coming from and ultimately provide the best treatment possible for them.
Yeah, we all want to be heard, especially in a situation like this. So, Dr. Brian Johnston, we really appreciate your time. Thank you so much.
Thank you.
And thank you for joining us. We'll see you next time.